Hello folks, this is James and today I want to discuss the clinical features of hyperprolactinemia using a simple mnemonic discharge because you will never know what life can milk out for you like abnormal breast milk discharge in males. Before we start, take a look at the medical mnemonic. Dyspareunia and vaginal dryness. The excessive prolactins may suppress estrogen levels as well as decrease the vaginal secretion. This ultimately causes vaginal dryness and leads to dyspareunia, which is a painful or a discomfort during sexual intercourse. Infertility, and this can be caused by the inhibitory effect on the production of gonadotropins, that is the luteinization hormone, as well as the follicular stimulating hormone. Now, assuming what I have here is an ovary, then let's recall from the menstrual cycle that during the follicular stage or the phase, we have a maturation of the follicles in the ovaries. So this is a follicle that matures into another big follicle that contains the egg. Okay, so what happens is that during that time, there are certain granulosa cells on the follicles. These granulosa cells produce estrogens. And so when the follicle matures into a ripe follicle, estrogen surge is quite high. And so there is a lot of estrogens in the blood during that moment. And that tells or signals the pituitary gland and the hypothalamus to bring in LH. So the luteinization hormone comes in, and that time there is a rupture of the follicle, which releases the egg, which is picked up by the fallopian tube. But the leftover follicle then forms the corpus luteum, which produces progesterone, and that helps in what we call the blastocyte implantation. So during hyperprolactinemia, there is a decline function of granulosa cells. There is also a decline in the maturation of corpus luteum, which helps release progesterone after ovulation. And so there is also a failure or a shortening of the luteal phase, reduction in the quality of implantation of blastocytes to the endometrium, as well as maintenance of this synchrony between blastocyte and endometrium is also impaired during hyperprolactinemia. Sexual dysfunction. Hyperprolactinemia may cause a reduction in the release of gonadotropin releasing hormone, and this leads to an inhibitory effect on the production of gonadotropins. That is to say, there will be a low LH as well as FSH, and this causes changes in sexual function such as arousal problems. A patient may lack the arousement or a decline in excitement in the sexual activities. Problems with desire, libido loss, or they will show no interest in sexual activities. There may also be a delay or absence of climax. In men, this may also manifest as erectile dysfunction. Compression by a prolactinoma. Usually the tumors that produces prolactins are microadenomas, less than 1 centimeter, but the tumors may be big enough to cause compression of any cranial structure and lead to symptoms such as headaches. If the tumor is positioned or located at the optic chiasm, it may also compress this structure and cause a visual field defect, especially by temporal hemianopia. Let's take a look at the picture on the left. So what I have here is a normal optic tract. So we have tracts, the nasal one, which is in blue, which crosses over to the contralateral optic tract. So this is the blue one, and it goes over to the other side, to the contralateral side. Okay, the nasal fibers helps with peripheral sight. So in other words, if everything with the nasal tract is okay, then the patient is able to see on the periphery. Everything here will be normal as well as that side. Now take a look at the picture or the figure on the right. So there is a prolactinoma, a tumor, which compresses the optic chiasm. In fact, we see that it is the nasal fibers that are suffering in this instance because the compression is directly on the nasal optic fibers. And so the patient wouldn't see peripherally. There's going to be a deficit And this is what we call bitemporal because it's two, and that is on this side as well as that side. And temporal means the patient is not able to see peripherally. This is what is called bitemporal hemianopia. Hot flashes and hirsutism. Hyperprolactinemia exhibits an inhibitory effect on the production of gonadotropins. The low state gonadotropins, or in other words, hypergonadism, makes the hypothalamus, which is the body's thermostat, to become very sensitive in regulation of the body's temperature, hence the hot flashes. Hirsutism may present with excess growth of hair, such as on the face as well as on other parts of the body. Note, we have discussed polycystic ovarian syndrome as a cause of hyperprolactinemia, which also presents with hirsutism. Excessive prolactin levels may lead to menstrual impairments such as amenorrhea or oligomenorrhea. Anovulation may arise from the improper rhythmical pulse release of gonadotropin releasing hormone, which inhibits the production of gonadotropins. Gonadotropins are very important in the control of follicular maturation, rupture, and ovulation. Any impairment at any of this level can lead to a menstrual impairment. Resorption of bone, osteoporosis. The hypoestrogenism that results from long-term hyperprolactinemia leads to decrease in bone mass density and causes osteopenia as well as osteoporosis. Galactorrhea is an abnormal secretion of breast milk in a non-lactating individual. It may affect both females and males with hyperprolactinemia. Prolactins promote the growth of alveolar cells of the mammary gland. Gynecomastia. This is an enlargement of the breast in males with hyperprolactinemia, and it may be associated with breast tenderness or nipple sensitivity. Emotional liability. Truly, the symptoms of hyperprolactinemia comes with very difficult psychosocial challenges. Obviously, it should be empathized that patients with gynecomastia, galactorrhea, sexual dysfunction, hot flashes, hirsutism, dyspareunia, infertility may become emotionally liable with anxiety, social withdrawal, and a decline in self-esteem. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.